All right, so today I'm talking about Ozempic. I think everyone already knows what Ozempic is. It helps people with weight loss and type 2 diabetes. The main ingredient in it is called semaglutide. But recently there was a clickbait headline from the FDA basically checking in about a few deaths, 3 deaths on patients of semaglutide. One was from suicide. And I want to do a quick note before I say anything else. The FDA doesn't say that these drugs caused the deaths or the problems. It's saying that the company isn't following proper reporting rules quickly enough. But anyways, I thought it was a good time to break down kind of the simple facts that we know about Ozempic, how it works in your body, the side effects, how it compares against other drugs like Wegovy or Zepbound, even why insurance pushes back so hard. Spoiler, it's money. But so let's look into that.
Welcome to Medicine Made Simple.
All right, so now I'm going to get into how Ozempic works, keep it super simple. So I'm going to work on 3 fronts. One is the brain, like the changes and things that it does to your brain. 2 is going to be your blood sugar, because this is actually a type 2 diabetes drug primarily when it started. And 3 is going to be your stomach, like how it actually works directly on your stomach. So the brain is the most interesting part, so I'm going to start there. Basically, you have a satiety center or a fullness center. So like it's in your brain, in your hypothalamus. It switches basically, it's like a thermostat, like hungry or full. So when you're hungry, you eat, and then at some point it should send a signal to your brain of like, hey, switch to full, and you should stop eating and you stop being hungry and thinking about food. Obviously, that doesn't work for most Americans, looking at our obesity numbers. But so that hormone that it releases to send that switch is called GLP-1. It's a natural hormone. So semaglutide is a synthetic version of that same hormone, but it lasts a lot longer. So because it sticks around longer, it keeps hitting that hypothalamus receptor and saying, you're full, you're full. So hopefully that's going to really drop down your urge to eat. Food just doesn't seem as tempting or rewarding. That whole dopamine pathway, it gets dulled also. So it is really just kind of turned up the volume on that natural hormone. The I've had enough button is just always pressed, or pressed more easily and more longer. So I think this brain effect is really the primary reason why you see people losing 10 to 20% of their body weight. That's one huge thing. The second thing that's kind of related I'll go into is the stomach slowdown. So not only does it make you feel full, it also actually slows down, because you know how your stomach, when you eat food, it obviously goes in your mouth, ideally, and then it goes down your throat, gets in your stomach, and your stomach will kind of push it through your intestines, etc. So it also slows down gastric emptying, which is how quickly food leaves your stomach. So that means that food hangs around longer, you feel full sooner and for much longer also. So not only is that I'm full button being pressed, but you're actually physically full. Your stomach still has the food in it for longer. And the third thing is the blood sugar fix. So Ozempic tells your pancreas, so quick thing. So your pancreas is an organ. It basically releases 2 things that helps in sugar, or that it has like a sugar pathway. So one you've all heard of is called insulin. So when your blood sugar is high, your pancreas releases insulin and brings your blood sugar down. Alternatively, there's another thing that it produces called glucagon, which will raise your blood sugar by taking glucose out of the body, out of places, your liver, etc. But anyways, so glucagon, which I always thought was weird because it sounds like glucose gone, but it actually increases your blood glucose. So that's kind of the pathway. Insulin will lower your blood glucose, and glucagon will increase it. So Ozempic tells your pancreas to release more insulin, but only when insulin's high. And it also blocks a glucagon. So anyways, this one's a little bit more complicated. I feel like I didn't do a great job explaining the blood sugar part, but it has an action on your pancreas as well. Hopefully that's somewhat clear. All right, so now I'm going to go into side effects, which is what the recent headline was about. So there are kind of common ones, there's rare ones, serious ones, etc. So the common ones are all going to be gut issues. The most common is nausea. About 20% of people feel like they're going to puke. About half of those do puke, so 10% vomit. Kind of people are eating too many meals, eating too often. So even though your brain's telling you, hey, stop, you're overriding it at the beginning perhaps, and you're going to keep eating, and your stomach hasn't emptied. There's nowhere for stuff to go, and you will end up vomiting. The other thing is, don't lie down post-meal. That will also, like, if you just think of gravity and things, you're lying down on your back. All the food's going to lay back here, and you'll get some regurgitation there. And then also you get diarrhea. It's about a little less than 10%. Regular diarrhea stuff, hydrate, things like that. You also get the opposite of diarrhea, paradoxically. You get constipation, so about 2, 3, 5% get constipation. Just walk it off, have some water, prunes or something, it's fine. You also can have abdominal pain, bloating. You get Ozempic burps, they talk about, which is like gas from your stomach being slow. There's more stuff, being fermented, and then you're going to be burping. You could also get gallstones in your gallbladder. That's, fast weight loss can cause this also. The serious ones, pancreatitis, problem in your pancreas and inflammation. You can also get some, if your stomach is too slowed down, you can get stomach paralysis called gastroparesis, and that will cause kind of bloating, painful vomiting. So that's a pretty small percentage, I think, like 1 in 1,000 or 1 in 500, something like that. And then kidney issues can also come. Again, like, this is a dehydration issue. And the last thing, there are some warnings about thyroid tumors, thyroid cancer. These have only been seen in rats. There's no cancer link in humans. But if you have a family history of certain thyroid cancers, or one certain type of thyroid cancer, then you're asked to talk to your doctor about it and maybe avoid this medication group. All right, so now we've talked about kind of Ozempic, how it works, what some of the side effects are. I'm going to talk a little bit about the kind of Ozempic and the family that I did on the thumbnail here. So Ozempic started off for type 2 diabetes, sugar control in 2017. But on those trials, the people there lost like 15% body weight. So immediately doctors realized that this is an off-label great thing for obesity because it curbs appetite so well. So they created a new formulation, just a higher dose of the exact same medication, the semaglutide. So they turned that into Wegovy, and it took some years, but they got approval for Wegovy for weight management in adults and kids older than 12, I think. So that was the story until more recently when these kind of new drugs came in, Mounjaro for diabetes and Zepbound for weight. So basically, Mounjaro is the alternative to Ozempic, and Zepbound is the one for Wegovy. So instead of semaglutide, they have something called tirzepatide. And tirzepatide does the same thing as semaglutide, which mimics GLP-1, but it also adds another one called GIP. And this one, remember I talked about the 3 things, how it works. It works on the brain, works on the stomach emptying, and it works on your blood sugar. So this GIP, it ramps up that blood sugar one that I feel like I didn't explain that well, but insulin brings your blood sugar down, glucagon raises it up. So it works on that mechanism a little bit more. So it basically does all the things of Ozempic plus this new thing. So on paper, they're better for weight loss because they ramp up one of those signals. So why does insurance hate these drugs? I don't know if they hate them, but insurance, again, really cares about money, doesn't really care about much else. It's an entity like that in general. So I've written about, professionally published on the old drugs. When they came out, they cost like $100,000. It was a huge deal back then, and insurance companies decided to not really cover them because it was basically a all-time cure. You take this drugs and you're done forever, because at the time they had a lot of other hepatitis drugs that they were gonna lose money on because they're all not gonna be used anymore. Anyways, that all said, these weight loss drugs are pricey. They are thousands a month per person, and when Ozempic first came out, a lot of doctors wanted to prescribe it off-label because it was actually doing a lot of great things. Despite social pressures or whatever, obesity is pretty bad for your health. Obesity causes a lot of other problems that we see, heart problems, diabetes, like everything. Obesity is a risk factor for a lot of things. So doctors were pretty excited that they could curb obesity. You can at least lose 15-20% of your weight, which is great. So obviously doctors wanted this to stop all the other kind of downstream effects of being fat Now insurance companies have really slammed these weight only ones. So the Zepbounds, the Wegovys, with a lot of hoops and things to go through. So prior authorization, step therapy. Sometimes they'll make you take like weight loss pills first, cheaper stuff, make that fail. Also, they just flat deny and say like lifestyle issues, do that. So Medicare has banned these obesity ones outright. And I think Medicaid also dropped this earlier this year. California Medicaid dropped it. So it's basically just they need to make more money in premiums. This has nothing to do with the efficacy of any of the drugs, as usual. That's my insurance rant. That's why they're not being covered. So if you can get the diabetic ones and you can get like a high sugar on your blood test, not saying to like game the system or anything, but that's kind of the easier way to get it through insurance, is to actually show that you have type 2 diabetes. Don't commit fraud. All right, so kind of to wrap up, I hope that was helpful. Ozempic is the brand name of semaglutide. There's the weight loss version, Wegovy. There's the new ones, the tirzepatide ones, the Zepbound and Mounjaro. You can check those out also. And if you're worried about the side effects, they're pretty well documented. And the newest headline shouldn't scare you that much. I've seen positive things. I didn't go into them about drinking, gambling, things like that. It also curbs the dopamine hits from these and reduces addiction. But again, like that's not super proven yet, so I didn't have sections on it. But yeah, I think if you're looking at weight loss and you have a lot of additional problems caused by weight, medical problems, maybe even personal problems, I don't know. Look into Ozempic and these things. If you have diabetes type 2, you can get it pretty easily. If you don't, you can try to fight for it. And, hopefully this helped, at least to learn if you're not getting on Ozempic. But yeah, thanks.